Dr. Kiki here. It's time with the gynae. So I'm moving today from the pregnancy topics to one topic that's relevant to our young ladies, especially those from age 9 to 14. So in 2025, September 2025, Ghana Health Service or Ministry of Health rolled out a vaccine that was aimed at preventing cervical cancer. Now, when I talk about cervical cancer, I think in my first video, I spoke at length about cervical cancer. It is the second commonest cancer amongst women in the country. And every year, cervical cancer kills about 2,000 women. And we have an annual infection rate of about 3,000. So 3,000 infections. Now, in Ghana, the incidence rate of cervical cancer is estimated to be around 27 per 100,000 women. WHO has a cutoff that each country is aiming at, that is 4 in 100,000 women. But Ghana has a higher figure. This means that the country has a long way to go when it comes to cervical cancer elimination. Now, this vaccine is aimed at preventing cervical cancer and is targeted at the virus that is implicated in cervical cancer, which is the HPV, that is human papilloma virus. Now, this virus is implicated in a lot of conditions in women, and the foremost one is cervical cancer. Cervical cancer, as we may know, obviously affects women only. But the infection, the HPV, does not only affect only ladies or only females, it also affects males. The reason why the target is on the females is that it is commoner in the female. So that is why the vaccine is now, at the moment, for only women. There's a campaign that it should be extended to the men as well. But financially, Ghana is not in the capacity to be able to roll it out for the men and the women. That's why the country is going for the ladies first. So what is the vaccine? What is it about? So when you take the virus, there are a lot of strains. That is, there are a lot of types of the virus. The ones that are most common in cervical cancer cases are the HPV 16 and 18, and these are the ones that the vaccine which is currently being used in Ghana is targeting. What we are using in Ghana is Gardasil 4. There are other types of vaccines, but these are the vaccines we are using in Ghana, Gardasil 4, and it is a single shot vaccine. So for every young lady from age 19 to 14, you are highly encouraged to take this vaccine. The vaccine is going to protect you against the HPV infection. The reason why the age 9 to 14 was selected is to make sure that you get the vaccine before your sexual encounter, because the vaccine protects you against the infection, and the infection is obtained through sexual intercourse. That is the main means by which the HPV is contacted. So the goal is that every young female gets it before their first sex. Now, if you have had a sexual encounter, you are encouraged to do a test to determine whether you have the infection before you take the vaccine. The vaccine is very, very relevant. Now, I'll give you some of the reasons why it is relevant. Aside the fact that it's going to protect you against long-term cervical cancer, it's going to also protect you against any form of infection that is, or any form of disease that is caused by the HPV. Now, in Ghana, it's something that was there. The vaccine has been in the country for over 10 years, but we've not had a national program which seeks to vaccinate people for free. So this is the first time we are doing such a vaccine for free, and the goal of the Ministry of Health is to integrate it into the immunization program, where every young lady, every young girl in Ghana from age 9 to 14 gets this vaccine. A lot of countries are working harder to eliminate cervical cancer. One of the leading countries is Australia. In Australia, currently, they are looking at 6 in 100,000 women having cervical cancer. So they are closer to the target of 4. Ghana is a long way behind. We have to move towards the mark. And if we want to move towards the mark, it is by getting this vaccine. People are wondering, am I not going to get any side effects when I take the vaccine? The vaccine is actually very good. You don't have any major side effects. As common to all vaccines, those mild headaches, fever, general malaise, or tiredness are associated with this vaccine, but it is not any serious side effects that should hinder you from taking the vaccine. The people who are eliminated from taking the vaccine or who are excluded are pregnant young women. Pregnant women are excluded, that's one, and anyone who is allergic to this vaccine. So I want to encourage all women. Some people are worried that, the fear people have about vaccine in Ghana. This vaccine is very safe. This vaccine will protect your young lady against a future infection of cervical cancer. So I want to encourage all the females out there. If you are in that age category, please get vaccinated. If your child is in that age category, encourage the child to get vaccinated. Where can you get this vaccine? Any public health facility that you walk into, they have an immunization center where the vaccine will be given. There are a lot of health facilities around. Just walk into any of them, ask about it. They will show you where you can get it from. Is it free? Yes, it's free for those within the age of 9 and 14. It is absolutely free. Do not be worried. Do not be scared about it. Now, some schools are also they are designated to be vaccination centers. So if your school happens to be one of them, please embrace it and get vaccinated, because you are doing yourself more good than harm if you take this vaccine. The HPV vaccine is safe. It is safe for the young girl. It is safe for all of you. Please get vaccinated. In another episode, I'm going to also talk to you, for those who are not in the age bracket of 9 to 14, how to get this vaccine. Now, to conclude, let me just give a recap on cervical cancer. Even though I did that in my first video, I just want to give you a recap. What is cervical cancer? The cervix is the lowermost part of a woman's womb. That's the mouth. What's in layterm, you can say the mouth of the womb, or the entrance to the womb. That is the cervix. So cervical cancer is the cancer that affects that part of the womb. And as I said, it only affects women. The cause or the virus that's implicated is the HPV, human papilloma virus. So what it stands to reason is that this cancer can be prevented. How can you prevent it? It can be prevented when you are vaccinated against this virus. So it's a very high risk virus that causes the cancer. So when you are vaccinated against this virus, it means that you cannot get cervical cancer, because you develop immunity against the virus which causes cervical cancer. So other means of preventing cervical cancer is delaying first sexual contact, because the virus is contacted through sex, and the longer the virus stays on your cervix, the more changes it can cause there, which can later implicate in cervical cancer. The next way of preventing it is avoiding multiple sexual partners. The reason is that you may contact it from this person or that person, and you may be picking it from people. Once this is happening, you are getting a higher load of the virus, and that can end up resulting in changes early in your life and lead you to getting cervical cancer. The next is when your immune system is low, that also puts you at a risk. So eating healthy, keeping a good lifestyle keeps your immunity up, and that is able to also, in a way, protect you. Now, another thing is avoiding smoking, avoiding alcohol, and all of that. So all these things are able to reduce your immunity, and by so doing, expose you to getting a glaring impact of this HPV virus. Now, the key takeaway is that this virus can stay in the woman for years before it starts showing symptoms. It can stay in you for years before symptoms are shown. The symptoms that will be shown are not exclusive to cervical cancer. What I mean is that other disease or other conditions in women can cause these symptoms. So once you have them, the best thing for you to do is to get tested. Go to the hospital, let them check you, let your doctor check you to know if it is the HPV that is causing those symptoms. One of those symptoms is foul vaginal smell. So if you're having foul vaginal smell, it's an indication that there's a problem there, because normally you shouldn't have that there. So if you're having it, please take steps to get it resolved. The next one is when you are having painful sexual intercourse. Sex is not supposed to be painful. So when you're having painful sexual intercourse, please get checked to see if there's a problem there. There's actually a problem, but if it is cervical cancer related or if it's HPV related. The other one is when you bleed after sex. Nobody's supposed to bleed after sex. So please, if you see that, please walk to the hospital and get checked. The other one is when you bleed even after your menses. Now there are so many conditions that can cause that, but one of it also is cervical cancer. So when you are seeing any of that, please take steps and get checked, get screened, so that you don't end up having issues with cervical cancer. The key thing is that the earlier it's detected, the better. In our part of the world, the reason why a lot of people die of cervical cancer is that they come to the hospital very late. By the time they will come, you'll be in the advanced stages. And at that point, it's difficult to treat. So the earlier, the better. Once you start seeing any of these symptoms, please go to the hospital. If they check and it's not cervical cancer, hallelujah. If they check and it's an early form of the disease, it can be handled, it can be dealt with, than to sit and wait, go to all other places aside the hospital. And then by the time you get to the hospital, it's probably too late to be treated. So cervical cancer is preventable. It's very preventable, mainly through the vaccination. So I want to encourage you again, please get vaccinated. If you are beyond the age bracket, watch out for the next video, which is going to target that particular age group, those who are outside age 9 to 14. Thank you. I'll see you again.